Welcome back to our viewers. This is Coffee Talk number 5, where we will be talking about looking to the future. So Jean, last time we met, we talked about some really positive changes that happened to our state law. We talked about some opportunities that were given and authorized for licensed dental assistants to be able to be working in community settings. And we also talked about eliminating the requirement for dental hygienists to have additional hours of experience over and above what they have traditionally been using in their clinical practice. We also clarified about who needs to provide the follow-up care for patients after a collaborative practice hygienist has seen the patient. And we also addressed some of the reimbursement issues too. So we talked about a lot last time. So this time I thought we should talk about a vision for what comes next for our viewers. Just the things that are involved in collaborative dental hygiene practice and some of the amazing opportunities that are possible through this practice model.
Yes, we certainly aren't done working on the future success of this model. It's exciting to look ahead at the possibilities. One newer innovation that comes to mind is the use of telehealth or teledentistry, which would allow the collaborative dental hygiene practitioner to get the data that she collects or he collects to the dentist in a timely fashion for a diagnosis and also an examination. And that would improve the outcomes we see with follow-up care, I believe. It's a great way to provide more services when there are barriers to getting that examination that's mandated by law. But telehealth and teledentistry requires some knowledge, and that knowledge needs to be in digital equipment and also in how to use the technology. Currently, dental hygiene students are being taught how to use digital equipment and also to use intraoral cameras. But the educational institutions really have a responsibility to see that future dental hygiene students are further prepared to follow the technology as changes come about. And also, teledentistry creates a new relationship with a hygienist and the dentist. And it's also a learning curve in that sense, that working with the dentist remotely to achieve those examinations and provide more complete care, will be a challenge.
Will be a challenge, but it's exciting at the same time. It's really wonderful that we can be looking to changes in our way that we practice. And as you said, this system is really going to increase the likelihood of patients attaining a diagnosis, which is always a topic of conversation when we talk about collaborative practice. And also to be fulfilling that follow-up care beyond the scope of practice that a dental hygienist can offer in a collaborative practice setting. And one of the topics that comes up a lot is the billing issue and how teledentistry can be affecting some of that as well. So some organizations have successfully worked with this teledentistry process, and the opportunities for that, as you mentioned, it can be either the dentist being present as what we consider as a traditional dental exam for diagnosis. But with teledentistry, it is also an opportunity for the dental hygienist to collect that information and to store those findings into a manner that is called store and forward, which works very well for some groups. And if a dentist is readily available, a virtual exam could be done with using teledentistry as well, or it could be done in real time, which is a nice way to do it, but it doesn't always work in all situations. Someone recently asked me whether or not the reimbursement is the same, whether we're using a telehealth, teledentistry exam, or the type of examination that traditionally we are most used to, and that is when there's a face-to-face encounter with the dentist and the patient. And using the system of teledentistry, the reimbursement rate is the same, whether it is a face-to-face or whether it's a virtual exam. And one thing that has been brought up too is the fact that there are dental codes that have been created for use of the teledentistry process. But the important thing about that is that this time the reimbursement is for the service provided, meaning for the examination. the reimbursement at this time is not for the use of the telehealth equipment or the telehealth process.
That's my understanding as well. You're correct in saying that, but hopefully at some point in time we'll see that becoming reimbursable, which would also increase the financial viability of that model. But let's look a little further into the future of collaborative dental hygiene practice in community settings. And this one really interests me, and some of it's happening right now, and that is the inclusion of dentistry to a dental medical model, where both can exist within the same facility and provide more comprehensive care for patients. Some hygienists are working in facilities right now, but they would need to have a collaborative practice agreement with a supervising dentist in order to provide clinical services. But now and in the future, we really look toward patients receiving care with that oral health component included in order to really achieve total health or a total treatment plan for that patient. And I envision that more dental hygienists will be involved in hospitals, nursing homes, OB departments, pediatric clinics, diabetic centers, and others working side by side with the medical team in collaboration.
Absolutely. And whenever oral health can be incorporated into a health visit, the patients are always going to benefit, which is really what we aim for, because we know that there's a very strong link between oral health and systemic health. The two just are hand in hand. And to date, a dental hygienist can be employed in those facilities that you mentioned, OB, GYN, or diabetes, but they're only authorized to provide those clinical services when a collaborative agreement with a dentist is in place, or if a dentist happens to be employed in that setting. So we need to make the system work when a dentist is not available to be part of that collaborative agreement. And it seems in the best interest of the patient that a dental hygienist should also be authorized to have supervision from a member of the medical team. For example, a physician assistant or a nurse practitioner. And with that mechanism for the medical history evaluation and having emergency support provided when there is the medical dental integration, that is really also going to benefit the patient. And that patient care model is happening in some other states. And the word I think that we've talked about and we've mentioned is use of the word integration. And I have recently just heard a compelling statement that mentions that integration is not merely just co-location. It's really integration is the key term there, that medical dental integration rather than provision of services in one consistent setting.
Claire, I strongly agree. Changes are coming in the future to make the medical dental collaboration more prevalent and successful, not only for the convenience of the patients and also to increase access to care, but I believe that it can really decrease healthcare costs overall.
And speaking of costs, as we just mentioned a few seconds ago, we talked briefly about some of the reimbursement issues. But in the future, we hope that some of these services that are newer, such as telehealth, will be reimbursable in a broader scope, and that rates of reimbursement will improve. The viability of alternative delivery models really rely on the reimbursement for the sustainability of the programs. And several oral health organizations have been diligently working toward this end, but progress has been made, but financial solutions are very complicated.
That's right, and it involves a lot of different entities to get together and create those solutions.
Good point.
And as we advocate for changes, we need to continue to educate dental hygienists, dentists, dental therapists, and dental assistants and how to make collaborative practice more successful and to employ these future trends. We need to speak with educators and work with them to identify how students can be better prepared to incorporate these trends into their practice, and also to initiate and create opportunities to increase access to care.
And also to increase the number of collaborative practices that are in existence too, by introducing dental hygienists to this viable opportunity. And as you said, the more we educate and talk about these situations, it will better prepare us to provide oral health services where people live, where they work, where they learn, and where they play. And that's what it should ideally be all about.
These coffee talks have been fun and hopefully enlightening for our viewers. I'm really excited about the future of our profession and also for opportunities for dental hygienists.